The Home Health Quality Improvement National Campaign welcomes you to this short multimedia module, Evidence-Based Foot Care. According to the American Diabetes Association, or ADA, in 2010, about 73,000 non-traumatic lower limb amputations were performed in adults aged 20 years or older with diagnosed diabetes. About 60% of non-traumatic lower limb amputations among people aged 20 years or older occur in people with diabetes. The 1993 landmark study, the Diabetes Control and Complications Trial, which was funded by the National Institutes of Diabetes and Digestive and Kidney Diseases, conclusively showed that keeping blood glucose as close to normal as possible significantly slows the onset and progression of diabetic nerve and vascular complications, which can lead to amputation. As you know, people who have diabetes are at much higher risk for developing neuropathies, which can lead to vascular damage. Early identification and early intervention is the key to prevent problems from occurring or worsening. The evidence is overwhelmingly clear that foot assessment and education is critical for people with diabetes. The Centers for Medicare and Medicaid Services, or CMS, also include diabetes foot care as a home health quality measure. The OASIS dataset item asks if the physician-ordered plan of care includes diabetic foot care, including monitoring for the presence of skin lesions on the lower extremities and patient-caregiver education on proper foot care. Diabetes foot care is not only a best practice, but also a process measure for home health. OASIS M2250B is asked at the start of care and resumption of care time points to assess if there were orders on the plan of care for both monitoring and patient caregiver education. OASIS M2400A is asked at discharge time point to assess if there were orders for monitoring and patient caregiver education and that it was done during the episode of care. The National Diabetes Education Program has developed the Feet Can Last a Lifetime Guide, which provides suggestions and examples for caring for diabetic feet. They have come up with 4 basic steps for preventative foot care: early identification of the high-risk diabetic foot, early diagnosis of foot problems, early intervention to prevent deterioration that may lead to amputation, and lastly, patient education for the proper care of feet and footwear. There is a link to the guide in the transcript of this module, or you can Google search for Feet Can Last a Lifetime Guide. There are many tools available to help you and the patient's healthcare team to include diabetes foot exams into regular practice. The 2016 ADA Diabetes Standards of Care recommend that a foot exam is done and documented at least yearly by the practitioner. But if there are problems, it should occur at every visit. You can see the specific recommendations here. These recommendations are written for practitioners as well as other healthcare team members like yourself. Many of these standards of care can be incorporated into your care if you are in home health, dialysis centers, nursing homes, or hospitals. The 2016 ADA Standards of Care include: perform a comprehensive foot evaluation each year to identify risk factors for ulcers and amputations. Obtain a prior history of ulceration, amputation, Charcot foot, angioplasty, or vascular surgery, cigarette smoking, retinopathy, and renal disease. Also assess current symptoms of neuropathy, pain, burning, numbness, or vascular disease, which includes leg fatigue and claudication. The examination should include inspection of skin, assessment of foot deformities, neurological assessment including a 10-gram monofilament test, and pinprick or vibration testing or assessment of ankle reflexes, and vascular assessment including pulses in the feet and legs. Some settings may not perform monofilament testing, but need to be aware that this should be done during practitioner visits. Patients with a history of ulcers or amputation, foot deformities, insensate feet, and peripheral arterial disease are at substantially increased risk for ulcers and amputations and should have their feet examined at every visit. Patients with symptoms of claudication or decreased or absent pedal pulses should be referred for ankle brachial index and for further vascular assessment. A multidisciplinary approach is recommended for individuals with foot ulcers and high-risk feet, such as dialysis patients and those with Charcot foot, prior ulcers, or amputation. Refer patients who smoke or who have histories of prior lower extremity complications, loss of protective sensation, structural abnormalities, or peripheral artery disease to foot care specialists for ongoing preventative care and lifelong surveillance. Provide general foot care education to all patients with diabetes. The risks of ulcers and amputations are increased in diabetic patients who have the following risk factors: history of a foot ulcer or a previous amputation, a foot deformity, peripheral neuropathy or peripheral artery disease, poorly controlled diabetes, visual impairment, nephropathy, and lastly, tobacco use. In 2014, an ADA task force created the Comprehensive Foot Exam and Risk Assessment, which takes less than 3 minutes to complete. This was developed so that the exam could be used by a wide range of healthcare providers, be completed quickly, and eliminates common barriers to frequent assessments. The exam consists of 3 components: take patient history, perform physical exam, and provide patient education. Some of the items that you may need to ask when taking a patient's history include questions such as any previous leg or foot ulcers, prior angioplasty, stent, or leg bypass surgery, tobacco use, slow healing wounds, diabetes diagnosis, and if so, what are current control methods, assessing for any signs and symptoms of neuropathy, leg pain at rest, or loss of sensation in extremities, and checking to see if they see a podiatrist regularly. When performing a physical exam, assess for discolored, ingrown, or elongated nails or fungal infection. Look for corns or calluses or other bony deformities. Also look for open wounds. You would want to perform a monofilament exam. Monofilaments are calibrated single-fiber nylon threads used to assess for lack of sensation in the diabetic foot. You will also want to perform a musculoskeletal exam looking for any abnormalities. Also assess vascular status, which would include hair growth, pulses, and temperature variations. Patients need to know how to care for their feet daily. There are simple and inexpensive tools that can assist your patients when they perform a comprehensive self-care foot exam. These would include such items as a mirror, lotion, powder, pumice stone, straight-edge nail clipper, nail files, and white cotton socks. Be sure to discuss the following aspects of foot care with your patients. It is important they examine their feet daily by inspecting them. If they cannot bend over, suggest the use of a mirror that is placed on the floor. Place the foot over the mirror, rotating the foot until every ankle is viewed. Look for redness, sores, swelling, or cuts. When applying lotion or powder, make sure not to place it between the toes because as it becomes moist, it could cause sores to occur. After bathing, instruct them to use a pumice stone to remove the dead skin from the feet and avoid cracking on the heels. Only use the pumice stone in one direction so you are not rubbing the skin. Then while the nails are soft, cut them using a straight-edge nail clipper, not one that is curved. If necessary, have them file nails straight across, not in a sawing motion. Encourage them to wear, if possible, white cotton socks to absorb moisture and to notice any drainage from sores that have occurred. Select properly fitting shoes, especially if there is a foot deformity. Stress that they should not go barefoot so they will prevent any injury to feet. In conclusion, it is important to remember that healthcare providers should empower patients to take an active role in their own healthcare. HHQI has provided a patient teaching resource called Feet and Shoes that can reinforce your verbal education. There is also a Minute Patient multimedia module titled Diabetes Self-Care that includes information about foot care for patients. HHQI would like to thank you for taking time to learn more about evidence-based foot care. This material was prepared by Quality Insights, the Medicare Quality Innovation Network Quality Improvement Organization, supporting the Home Health Quality Improvement National Campaign, under contract with the Centers for Medicare and Medicaid Services, an agency of the U.S. Department of Health and Human Services. The views presented do not necessarily reflect CMS policy, publication number 11, scope of work, WVHHMMD 042516D.